Today, I'm going to talk to you about some of the common skin problems that people usually ask about, and among these, one very important topic is acne. Today, I'll be discussing acne. What is acne? Why does it happen? How to prevent it? I'll talk today about the care routines that can help you avoid or reduce acne. What is acne? Well, acne is when the hair follicles in our skin get clogged at the root, which leads to acne forming. Why do they get clogged? When dead skin cells accumulate inside the root of the hair follicle, or when the natural oil secreted by our skin, which we call sebum, is produced in excess, that too can clog the root of the hair follicle. If someone has significant hormonal disorders like polycystic ovary syndrome, thyroid issues, or other problems, these hormonal fluctuations or imbalances can also lead to increased sebum secretion. This is another important reason for developing acne. People who rely heavily on fried, oily, spicy, or fast foods also tend to have a higher risk of acne. Then there's the issue of dust and pollution. We face a lot of dust in our daily lives. This dust can also accumulate and block the root of the hair follicle. Additionally, for women who use various makeup products, whether it's foundation or anything else, sometimes we don't clean it off properly. When you get home, you must thoroughly clean off your makeup with a good cleanser. Otherwise, the clogging of the hair follicle I mentioned becomes much more likely, and so does acne. And for those who have dandruff, almost everyone has some degree of dandruff. If you have a lot or even a little, you need to use a good anti-dandruff shampoo. Because dandruff problems can also make it difficult to control acne. These are some of the issues we see in patients. At what age is acne most common? This is a very common question. People want to know, I'm already this old, so why am I still getting acne? I'm already an adult. Why am I still getting acne? Actually, what we call acne or pimples usually starts during teenage years, and it can continue for quite some time into adult life. It can occur up to the age of 35 to 40. This is because the hormonal fluctuations begin in the teenage years and are most intense during that period. That's why teenagers, both boys and girls, experience a lot of sebum secretion, which increases the tendency to get pimples. However, that doesn't mean that once someone gets older, say 25 or 30, they can't get acne anymore. It can still happen. As long as someone is young, their tendency to get acne remains higher. Generally, acne can occur up to around 35 to 40 years of age, though not for everyone. Proper skin care can help keep acne under control. In this case, we recommend a very good cleanser. We tell patients to use a high-quality cleanser, definitely a dermatologically tested product. There are many cleanser products available in the market, but not just anything will do. You should use a good cleanser as advised by an experienced skin doctor. If you also have dandruff issues, you should regularly use a good anti-dandruff shampoo. You should use it every other day or every 2 days like this, right? This will help keep acne problems a bit more under control. However, if the acne is very severe, then you definitely need to seek treatment. There is a common belief among people that acne has no cure, that it never really gets better. Some say, what's the point of seeing a skin doctor? It doesn't help, I tried it myself. It didn't help at all. After a while, the acne came back. These kinds of things are commonly said. But actually, that's not how it is. Like I mentioned a little while ago, acne can occur up to a certain age or during a certain period of life. However, it needs to be kept under control. To keep acne under control, I need treatment. Otherwise, if acne gets too severe, it can affect the skin, scars or pits left by acne, or marks that remain. These tend to happen more if the tendency is high, but there are very good treatments for acne. There are highly effective treatments available. Now, as skin doctors, we usually For acne, if someone comes in with just a few pimples or mild acne, or if someone is told to take mild medication, in those cases we usually suggest some topical medicines. These help keep it under control. Or if the acne is more severe, then we also suggest some systemic medicines. In terms of treatment, it usually takes a bit of time. Acne treatment tends to be a longer process. Sometimes, for some patients, the acne can be brought under control within 3 months. For others, it might take up to 6 months. The main point is that acne needs to be kept under control. Whenever you have acne, you should definitely consult a skin doctor and continue with regular follow-ups with the dermatologist. It usually takes 3 to 6 months. For some people, the acne subsides even earlier. The inflammation gets under control. We usually tell patients that your acne should be controlled within 3 to 6 months. After treating the acne, for some people, marks or scars remain. Some develop pits, which we call acne scars, acne spots, or pigmentation. Now, let's talk about the treatment for those. These days, people don't just sit around with this problem. People know that nowadays there are very good treatments for acne spots and scars. In aesthetic medicine, we have various types of treatments, among which one of the most important is microneedling with PRP treatment. This is very effective for acne scars. Alongside that, we can also mention peeling treatments. Peeling treatments are currently working very well for scars and spots. Another very important thing is laser treatment. Laser treatment is now very popular in our society, and through laser treatment, acne spots and scars can be treated very effectively. You could even call it magical. Before, people didn't know how to treat scars, like how to deal with the pits and bumps left by acne and whether those could ever really heal. Yes, they can be treated very well. For those of you who are aware of these issues, come to us with your problems, and we will do our very best to help solve them for you. Along with that, I'd like to say that we should be mindful about what we eat and drink. We need to be conscious about it. Make sure to get regular sleep at night and do some exercise. After waking up in the morning, do some basic exercises. When it comes to food, we should avoid oily, fried, spicy foods or fast food. Eating plenty of foods rich in vitamins is essential for your skin. This is good for your skin as it strengthens the collagen in your skin. It makes it stronger, and along with that, vitamin C and vitamin D are also very good for our skin. We need to eat plenty of green leafy vegetables and colorful fruits. So, the main point is that we have to maintain a healthy lifestyle. If we do that, it will really help make our treatments much more effective. So that's all for today. I've already talked quite a bit. I believe that if a patient follows what I said so far, it will benefit them a lot.